Hey, how's it going? Just wanted to talk a few minutes about some blood work, especially for people who are pre-diabetic or diabetic, and give you some values and some numbers and the way that we think about it. So the first one would be blood sugar. What is normal is between 70 and 110. And the value of knowing this over time is you could see a trend. So if you started out 3 or 4 years ago and your blood sugar was, say 75, and then you did it recently, and that sugar now is up to 100, 102, 105, or it's pushing up towards 110, even though you're technically still falling into normal, you're definitely in a trend that's suggesting that there's some problems with your glucose metabolism. So that trend, if you keep your blood work and you keep hard copies, which is what I tell my patients to do, is keep hard copies. Keep hard copies in your file, and then you could just look at it. You can just say, okay, in March of 2015 I was 75, and now in October of 2018 I'm 98. So that trend is kind of pushing up, and that's a suggestive trend that you might be developing some insulin resistance. It doesn't have to be, but it could be. So that's the first thing we want to look at. The other thing we want to look at is HbA1c, and I just recently did a video on HbA1c and what it means. But essentially, HbA1c is an indicator of how much glycosylation. This is where I lose people. So it's how much sugar is stuck to your blood hemoglobin. So when we start talking about this technical stuff, people tune out. But it's an indicator as how much sugar is stuck in your blood. And as that number goes up, the amount of oxygen that you can carry in your blood goes down. And that's a problem because your cells and tissues need that. So if the tissue is in your feet or your eyes or your kidneys, those capillaries that get down into that level are really, really small, and the oxygenation can't occur as well because there's too much sugar bound onto the molecule, and the capillary is very tiny, so the molecule gets too big. So what happens is you develop tissue death, tissue necrosis. You start to have gangrene in these areas, or you start to have organ dysfunction. So HbA1c, not more than 5.4, and that is lower than what most would say. However, I like that because it is a bit aggressive. It does demand a higher level of scrutiny, because you don't want that to be trending up as well. You don't want to be looking at that and saying, oh yeah, this is going higher every year as well. So again, in your blood work, if you're 5s, 5.4s, and then you're 6, you're 7, you're starting to develop insulin resistance for sure, and you're also developing damage. So the problem with this number is, when it's high for a prolonged period of time, there's tissue damage that occurs. Your body can heal, it can get better, but you need to still keep on top of it, because your body may not be able to out-heal the pace of the destruction that's going on. So you need to stay on the leading edge of it. Also look at fasting insulin. Now this is one that most of your primary care doctors will not run. I am starting to see it a little bit from patients who see certain endocrinologists, but really at this point, this should be a standard test. It's an inexpensive test, and what it tells you is how hard is your body working to maintain blood sugar at a normal level. And so you could have normal blood sugar, normal HbA1c, and still have high insulin. And what that means is that your body is working very hard to stabilize your blood at a normal level. And so all of that insulin in the blood is bad for you, just as all that sugar in the blood is bad for you. So having high insulin in your blood causes things like hypertension. It causes atherosclerosis. It causes endocrine disruptions, hormonal disruptions like estrogen problems, testosterone problems in men. So these types of things are things we can monitor. And again, it's a trend. If our fasting insulin levels are 3s and 4s and suddenly they're 6s, 7s, 8s. I had a patient that had normal HbA1c, normal blood sugar, and so then I additionally ordered the insulin test, and it was 6 times the upper level of normal, which means her body is working very, very hard to maintain homeostasis. So she has insulin resistance, and that there's a number of reasons why you get that, but the most common thing would be that you eat too often, you eat too much, and then you're eating too many starches and carbohydrates. Those are the biggies. There's other theories out there, and it is theory. Each person is an individual. Not every person reacts exactly the same way, but those are the generals. You're eating too often, so you're eating 6 times a day instead of 2 times or 3 times a day. You're having frequent snacks that elevate your insulin, and so the body has food around all the time, and every time you eat something, especially carbohydrates, then your body will release insulin. And it also releases insulin with protein and much less with fat. But the more often that this happens during the course of a day, the higher the chance that you're going to develop some level of insulin resistance. So the model of eat 6, 7, 8 meals a day, 8 tiny meals a day, I don't suggest. I don't think it's a good idea. I think it causes insulin resistance in a lot of people. And this is why now every other Facebook, YouTube, Instagram thing is about intermittent fasting, because intermittent fasting allows for a refractory period where you don't have to have insulin being pumped out. And then when your insulin levels are low, that means that you can efficiently metabolize body fat as energy. When insulin levels are high, that means that you cannot metabolize body fat as energy. And that is a big problem in terms of metabolism. So that's what I call the broken metabolism. That's my fancy name. If I see high insulin, you have a broken metabolism. The other factor now is triglycerides. And triglycerides are important to monitor because what they suggest is how much lipids, how much glucose is being turned into triglycerides, which is basically a molecule heading towards fat deposition. So we want that level to be under 150, ideally 100 or so. And that's just saying that your body is maintaining homeostasis well. Triglycerides can get elevated with liver and pancreas stress and metabolic syndrome. And then more times than not, when you see these high numbers, you're going to be likely prescribed a statin drug or something of that nature. But I have very, very, I'm not super keen on that methodology. I don't think that it works, first of all, but I think it also makes a lot of people sicker. So one of the first signs that we look at with people who have elevated blood insulin is that they get hypertensive, and then they usually get a hypertension medication, and then that exacerbates their insulin resistance, and so the problem doesn't get better, it gets worse. And so then they get 2 drugs, and then they get a cholesterol drug. And so these are problems. These are things that it has the domino effect when the original base problem may be what we call metabolic syndrome. So this is stuff to keep in mind. I want to keep this video brief, but this is something to keep in mind. Again, ask your questions, share the videos if they're beneficial to you, like them, pass them around, and then most of this content will wind up in my metabolic programming group, which is going to be where pretty much everything will wind up eventually as we start to get closer and closer to me getting rolled out with the book being done. All right, thank you so much. Enjoy your day. Take care, Facebook. Have a good one.